Hi guys, I'm Trish. This is my fatish. Let's see if I can get through this one. This is a hard one for me. Now, if you've been with me for a while, you'll know that I have had a lot of surgeries, and I'm not even talking about the ones that I've spoken about on this channel. There are so much more. I think I'm up to about 18 or 19. I can't remember. I'm having another surgery on Monday, and I haven't made any other videos about this because it's too hard for me. Now, as I said, you know what I'm like with surgeries. I'm for the most part pretty brave. I'm pretty matter of fact. I know what goes on with them. Every single surgery that I've had in recent years, you know, like since the advent of the internet where you can just go and look up shit, I have watched every single surgery that I have had. Like I can tell you I don't think there is a video on the internet of hysterectomies, tummy tucks, breast reductions, sleeve gastrectomies or lap bands that I haven't watched. But this surgery that I'm having on Monday, and it's a very minor surgery, very minor. I'm just having a tooth out under a general anaesthetic. I can't research it more than the very bare essentials that I need to know. So this video isn't about informing anyone of any like actual medical / dental knowledge that I have about this, because I don't have any. This for me, and do you know what, I hate these people when you say to them, oh, you know, how was your surgery? How are they doing it? Blah, blah, blah. And they go, I don't know. But that's me. That is the person I am with this one, because I have a dental phobia. I never used to. I have 3.5 phobias, right? My first phobia is big, deep, open water. And I know exactly why I have that phobia. So it's like if I'm at the beach and I can't go out further than where I can still touch the bottom, or where I can't see what's on the bottom, or I can't see the bottom. But other than that, I go to the beach, I get in the water, I'm fine. I've even been paddle boarding and loved it. It was terrifying. I did that partly because I wanted to paddleboard, but also partly to try to conquer that fear. I still haven't conquered it. There's a pier to pub swim that I want to do, and it's open water, and it's only 1 kilometre. I can swim 1 kilometre, that's fine, but to actually swim that far in that much water, I don't know if I'll ever be able to, but I hope to one day. But yeah, that phobia makes sense to me, because I've had people in my life who have drowned. I had an ex drown out in Port Phillip Bay, and you know, they never found his body. I have almost drowned 3 times. So that's a completely understandable fear. I also, this is a weird one. I have a needle phobia, right? Now it's not this is where the half comes in. It's a half phobia, because I'm not completely phobic. I turned the aircon down so that it wouldn't be on the video, but I'm sweating, so I've got to turn it back on again. Yeah, my needle phobia, that only gets a half, because I used to have a really bad needle phobia, like all needles, but I went and became a qualified pathology collector, which includes phlebotomy, which is when, you know, when you go and have a blood test, except that I can't work, but I am qualified to draw blood out of people's bodies. So that was like, I don't know what they call it, like confrontation therapy or something, but like where you have that fear, that phobia just thrown in your face. That's what I did by accident. I didn't intend to do that, but that's how it worked. So some needles I'm fine with now. If I've got to go and get a blood test, that's a good time for me, because I get to, you know, have a chat with my phlebotomy lady, and that's fine. If I'm in hospital and have surgery and need to get a Clexane injection in my tummy, I'm fine. I won't get them in my thighs because they fucking hurt in your thighs. In my tummy, I'm fine. I'm fine with, mostly fine with vaccinations. I can go and get a vaccination and it's okay. I don't like it, but I'm fine. But when I've got to get an IV, and that's really just like a blood test, but they leave it in there, but I get extremely anxious. So that's part of my fear coming up on Monday, because I know for the general anaesthetic they're going to have to put an IV in. But I think my fear is feeling out of control with that, because every now and then, most anaesthetists are absolutely fine. I go in and I say, my hand veins don't work. I've got nothing on this side for you. I have one vein here that is fit for purpose. If you had to put me under and keep me under for a very long time or for days, it's not a good vein, but you can pop me off to sleep, put one in here, pop me off to sleep. If that doesn't suit you, then once I'm under, put an IV anywhere else in my body that you want. I've actually woken up from a surgery with an IV in my foot. Didn't bother me because I wasn't awake when they did it. So I think for me it's a bit of a control thing, and worrying that the anaesthetist won't listen to me when I tell him, you will not, I don't care how good you are, you will not be able to get a vein in my hands. But they used to be able to, but those veins tissue anyway. They always want to go in here, the bruise I had from that one, because it immediately blew. I know my body, I know what it can and can't do. So anyway, that's my phobia number 1.5. My other phobia is losing teeth. Now, I'm 54. I have looked after my teeth my whole life, with the exception of when I was a kid. I think when I was about 8, there was a period of about a year when I didn't brush my teeth properly. I just sort of, like did the front surface of them, and that was it. But since then, I look after my teeth. I go to the dentist as regularly as I can. I get them cleaned. I get fillings when I need them, which is very rare. But in my back teeth, I have very deep grooves, and I can't tell you what the proper technical dental term is for them because of this whole dental phobia. I can't look up too much stuff on it. But the grooves in the back of my teeth are very deep. So when I was a kid and teenager, I had fillings in my back teeth. The old grey fillings, the mercury fillings. Mercury fillings? Amalgam fillings. And that wasn't because I wasn't brushing properly. It's because the grooves in my teeth are too deep to be able to brush properly. So I ended up with a lot of fillings in my back teeth, and they were quite deep. And apparently when that happens, with the old fillings, they're not fillings that last forever. And because they were so deep, it over time does weaken the teeth. But I do have all of my own teeth. I've still got 32. I've still got all my wisdom teeth, even though they gave me hell till I was about 25, with erupting, but they're fine now. And just speaking of phobia of losing teeth, and I don't know why, but maybe if you're a Stephen King fan, maybe, can you see that book? Only Stephen King fans will actually get this. Might have been that book that did it, because I started having nightmares when I read that book many years ago. In the book, a little bit of a spoiler, people's teeth fall out, and I started having nightmares about it. And in the dream, they would have nightmares about their teeth falling out, and then their teeth would fall out. I think that's how it went. It's been a long time since I read the book. And my 4th phobia, or 3.5, but this is a full-blown phobia, is dentists and having dental work done. Even just walking into a dentist, even calling to make an appointment to see a dentist. So this tooth down here that has become my little problem tooth, I think it was about 8 years ago, I'm not 100% sure, but it was a long time ago. The boot of my car was really loose before I fixed the struts. I've only recently fixed the struts because I didn't know that it would be so easy to actually fix the struts. So it used to fall quite often, and so most of the time you'd get someone to hold it up when you were putting stuff in the boot, or you hold it up yourself or whatever. Be very careful. But back then it was very hit and miss as to whether or not it would actually fall. So I'd go for a few weeks and it wouldn't fall at all, so then I'd get a bit sort of forgetful and a bit careless, and then it would fall. So one time I was putting something in the boot of my car and it came down and it hit on my, I can't remember if it was the back of my head or somewhere, it hit my head somewhere. My teeth smashed together, and at the time I didn't know that I had actually broken this tooth and cracked this tooth as well. That tooth has been fixed. They were able to save that tooth. That was very, very traumatic. It's got like a crown that's not a crown. It's a gigantic filling that goes over the whole surface of the tooth and like around the tooth as well. I had to have a like a metal band around it for a while and everything. But they were able to fix that tooth and save it, and it's pretty good now. It does still give me a little bit of trouble if I chew really hard stuff, but in the interests of keeping that tooth, because it's a healthy tooth. There's no problems with the root or infection or anything. But this tooth, I think it was the day after, after I like smacked my head and had a bit of a headache and whatever, and just that was a bit silly. Went to bed that night, had a dream that my tooth fell out, right? And I didn't think anything of it. I just sort of woke up, because it's not unusual for me to have nightmares about my teeth falling out. Woke up and I thought, oh, that wasn't a very nice dream. And so then I went and got in the shower, and I was brushing my teeth, because I brush my teeth in the shower. I was brushing my teeth, and sometimes you dislodge a big bit of food that's been in your mouth. And so it felt like that. And I thought, oh, I wonder what that is. And I thought, I'll spit it into my hand because I want to see, what bit of food it is. And so I spat it into my hand, and it was about a third of the biggest tooth in my head that it just broke off when I was brushing my teeth. And so I'm standing in the shower because I knew immediately that it was my tooth, and then I felt, with my tongue, and I'm standing in the shower, I panic attack immediately, and I'm just like, oh my God, because it's my third tooth from the back, so on the bottom. So if you go wisdom tooth, molar, and then it's that molar, right? It is a big tooth. Have a look in your own mouth. You'll see how big that tooth is. And then imagine a third of it just breaking off. So I'm like, oh my God, oh my God, oh my God. So I got out of the shower and I called the dentist straight away, and they got me in to see someone that day. There was no pain. I was able to still, brush that tooth and everything. There was no pain. I've only started having pain recently with it. So they sent me to a dentist. I go to the local dental service at the local integrated health centre that's part of the hospital here, because in the public system. And they were all booked up. So they have an emergency system where you get a voucher from them and you can go to another dentist, like a private dentist, but they pay. You pay the co-payment or whatever. So I went to a dentist that I've never been to before because I couldn't get into my other backup dentist. And she was in a rush, right? Because she wanted to get to lunch. I don't want to make accusations, but I think she'd been drinking, right? Because she was just all over the place. I was already anxious because a third of my tooth had broken off, and I had a phobia about losing teeth. And so she said that it needed a root canal, right? And that, because if you know any, I don't know much about root canals at all because it's too much for me. But with a root canal, I know that it needs to be done in stages. You can't go to the dentist and have a root canal done in one appointment, right? So she said, I'm going to start the root canal today, and then you can come back and we'll do it over time. And so, okay. Because, I thought, they can at least numb me up and whatever. So, number one, she gave me a local anaesthetic that had adrenaline in it, which is a normal thing to do. When you get a local anaesthetic for your teeth, you can have one with adrenaline, one without. I already struggle with anxiety. She pumped adrenaline into my body, so I started shaking from head to toe, and I didn't know what was happening. It induced a panic attack in me when I was already very, very, very anxious. And then she was trying to, I've just got to get through this. The tooth didn't go numb, right? She tried to anaesthetize it, the tooth didn't go numb. So then she said, you know, I'll see if I can like drill it out and we'll get this part done, because if it hasn't gone into the nerve, we can get this part done. I was okay. But if it hurts, you've got to stop. She's like, yep, of course. And all this time, she was flitting between me and another patient, in and out, in and out, in and out. So she started drilling, and it didn't hurt, right? Until she got down to, it must have been the nerve or something, right? And I can't talk about that, but there was a sudden jolt of pain. It was like being hit in the face, right? So she said, okay, I'll stop because this isn't going to work. She said, I'll just fill it. But she said, there's an infection in the root that I have to inject some antibiotics into. She said, I have to do that. It is going to hurt, but we have to do it. So she did that. She did it. It was 2 injections into the root of my tooth. And it hurt so much, and I can't talk about that anymore, but I got through that. She filled the tooth, that didn't hurt, right? Now that filling lasted for a while, and I didn't really chase it up too much, even though she said I would need root canal work done. So because it was too hard for me to go back and do anything. I didn't go back to her. I went back to my regular dental service, and they tried, I think it was 4 times to do that root canal on that tooth, and a couple of times, you know, like the temporary filling fell out. The one I've got in there now is superb. It's been in there for years. It's been fine. I chew on it, everything. And every time they've done the filling on it, like redone what is an emergency filling, they didn't numb me up, because I didn't need to, because it didn't hurt. They were able to drill what they had to do to get the filling in. But when they've tried to actually save the tooth, like to do the root canal, and they've tried this about 4 times, when they did the anaesthetic, at one stage, they put so much anaesthetic in there, they never did adrenaline again, but my entire side of my face was numb, including my ear, but that tooth didn't go numb. So they were never able to do the required work on it, right? So they referred me to the dental hospital in Melbourne. I'm not going to go into too many details there, but I have a lot of trouble stepping foot in that dental hospital. It's too chaotic. When I go to my local dental service, I'm very anxious, but every single dentist in there, except for one, but I've never had her, only my kids have, they're just absolutely wonderful. One time when I went in there, I was so anxious that one of the other dental nurses came and held my hand for the entire time. They're fantastic. So I don't have too much trouble going there. I still go regularly to get my teeth cleaned and get them checked, and, you know, like when I have pain and all the rest of it. So this one, it has arced up a couple of times, and I go and I get antibiotics and it settles down. But this last time it started up probably about 6 weeks ago, I guess. And I was already on a waiting list to go to the dental hospital to have it taken out. But, you know, the public waiting lists are really long. It was supposed to be done back in July, but it didn't happen. And because I have this phobia, I didn't chase it up, and my tooth wasn't hurting at the time. So, but yeah, it started up about 6 weeks ago, and I got some antibiotics, which helped a bit, but it was still really quite painful. And when I say painful, I mean it was throbbing and keeping me awake at night. I couldn't chew anything on that side. I was still able to like brush my teeth, and I use a water flosser. I was still able to do that because I then didn't want to get like, you know, secondary, you know, infections in my gums and all this sort of thing. But then it was starting to get quite bad because I couldn't chew anything on that side. And if you've gone, like if you've ever done mushies or fluids, you'll know that when you go for a few weeks without like actually chewing anything, your gums get really, really sore. So that was starting to happen. So I started to just very gently just have very soft foods chewing on that side, and sort of like built it up. And now, because what happened about 2 weeks ago, almost 2 weeks ago, it was really, really painful. And then just like someone turning a tap, the pain stopped. It was like literally 1 second, really bad pain, then the next second, no pain. So I was able to Google that enough to know that that means the tooth has died, which is weird because the last time I went to the dentist earlier this year, they told me that tooth was dead. Obviously it wasn't, or it's like gone full Easter on me and resurrected and then died again. So at least there's no pain, but then I got swelling on the outside of my tooth, like from in the gum, from where the tooth is showing down to the root, swollen, and then the redness and the swelling started to come down here as well to the next tooth. And I know, that's bad. That's bad, and it's bad when the tooth dies and like the pain suddenly stops, because it doesn't mean the infection is gone or the abscess is gone. It just means you can't feel it, and if it spreads, you won't know it. And it is. I haven't been to the dentist because I'm going into the hospital in 2 days anyway. But it looks to me like an abscess, and for about a week when it first came up, it was quite sore. It's not really sore anymore. Sometimes if I do that, I get a sharp nerve pain through the tooth. It's not doing it at the moment, but I haven't eaten today. As soon as I eat something and chew on that side, I will get that pain, but it's nothing bad. So then the redness subsided, and it's just on that one tooth, and I have been keeping an eye on it because it can go septic and kill you. Not to be too dramatic about it, but dental phobia and teeth and everything. So I feel like I'm sort of playing a waiting game to get in and get this tooth taken out. But yeah, so I called the dental hospital, would have been about 9 days ago now, to say this is what's happening with my tooth. Can you tell me where I am on the waiting list, because I'm really worried about it. And they sort of went away and they spoke to someone, and they came back and they said, how do you feel about having your tooth out just before Christmas? And I said, I'm happy with that. I need to get this over and done with. So it will be coming out 6 days before Christmas. Now it's just a tooth extraction. I should be fine, and I don't even know. I don't know if I'm going to have stitches or anything. I haven't been able to look up anything about it. I tried last night, and I can't get the images out of my head. So I am going in blind. I don't know I don't know what to expect. I don't know what's going to happen. I did look up some stuff about what's it called? Dry socket. That's when the blood clot doesn't form in the empty space where they take the tooth out, and it can be extremely painful. If that happens, it would be bad, but that's not what my concern is, because I know I'll get through it. It will last for a few weeks, and I can get treatments for it. I can take painkillers for it. That's not the issue. It's them actually putting me under and taking a tooth, the biggest tooth in my head, like out of my mouth. On the upside, my daughter is studying to be a dental tech at the moment. She's making teeth. That's what her job is going to be. She's going to be that person who makes, dentures and crowns and all this sort of thing. So she's going to make me a tooth. Not a tooth for like all the time, because it's at the back. No one's going to see it, most likely, I hope. But probably just what I'm calling a good going out tooth, because I'll never be able to afford to actually get an implant or anything, and they can't do like well, not that I'm aware of. I don't think they can do a plate that's just one tooth. Or they can, but the discomfort of it is just not worth it. But you can get what's called a flipper tooth, which is just a tooth that you just put in there and it hooks around your other teeth. So I've already told my daughter, as soon as she's qualified, she can make me a good going out tooth, and that'll make me feel a lot better. And I'm hoping that I can still chew on that side, and that I'll be able to chew on this side without causing any problems to my problem tooth on that side that hasn't been a problem since a couple of years after I got it fixed. It took a couple of years to settle down. And I'm hoping that once I get this done and I get over I can heal from it, and I don't just mean physically, I mean like mentally and emotionally, I'm hoping I can then go and do some proper research so I can come back and be a little bit more informed when I'm telling you this, rather than just sitting here telling you how scared I am of having it done. But I think that's all. I'll give you an update after I have it done to let you know how I went with it. But it's really just going to be like this video, just how I feel about it, with no actual proper information, which is a bit unusual for me when we're making these sorts of videos. I was going to show you the tooth, but I tried to take photos of it the other day to send to my family to gross them out with the ulcer on the side of it, and it just doesn't work. It's too hard to like get in your mouth with the correct lighting and actually see shit. So that's it. Wish me luck. Oh, and also I'm going to leave the comments turned on, but until I have healed from this, I won't be reading them or responding to them, because I don't want to hear people's horror stories. I don't want to hear any interesting little factoids about it. I really just need to bury my head in the sand on this one for now. But I will eventually, I'm hoping, be able to read through comments and respond. All right, that's it.